Imagine waking up every day knowing that before you step out of your house, you need to put on a mask. This has been the reality for many of us in the past year. The mask, once a symbol of anonymity, has now become a symbol of safety, responsibility, and solidarity. Physically, the mask can be uncomfortable. It can cause foggy glasses, skin irritation, and difficulty in breathing. But these discomforts pale in comparison to its benefits: the reduction of virus transmission, the protection it offers to the vulnerable, and the lives it helps save. Psychologically, the mask can be a source of stress and anxiety. It hides our smiles, muffles our voices, and creates a barrier that makes connection feel more distant. But on the flip side, it also serves as a constant reminder of our collective responsibility in this pandemic. Every time we put on a mask, we are actively contributing to the safety of our community. But what does it feel like to wear a mask every day? It's a small act that takes a minute to do, but its impact is immense. It's a symbol of our times, a testament to our resilience, our adaptability, and our unwavering commitment to each other's well-being. As we dive into the mask debate, remember that each mask worn is a life potentially saved, a healthcare worker potentially protected. Wearing a mask is a small act with a big impact, a simple step towards turning the tide against this unprecedented global health crisis. Is the mask debate putting our health workers in jeopardy again? This question has become increasingly relevant as we navigate the complexities of the global health crisis. In the midst of the ongoing debate over the necessity of wearing masks, we find our health workers once more bearing the brunt of the fallout. As cases of COVID-19 continue to rise in certain areas, an alarming correlation is emerging. These areas often coincide with places where mask usage is low, sparking concern among health professionals and epidemiologists alike. It's important to note that this isn't just a matter of numbers. Behind each statistic is a person, a community, a healthcare system under strain. When we talk about an increase in cases, we're also talking about increased hospital admissions, longer working hours for health workers, and a greater risk of burnout. The impact of the mask debate on our health workers cannot be overstated. Yet this issue is far from black and white. On one hand, we have the undeniable necessity of masks as a protective measure. On the other, we grapple with the challenges of compliance and enforcement. The tension between individual rights and collective health safety is at the heart of this debate, further complicating an already complex issue. Health workers stand at the crossroads of this debate, caught in the crossfire of differing opinions and policies. They continue to risk their own health and well-being, working tirelessly to care for the sick even as the debate rages on. So we find ourselves asking again, is the mask debate putting our health workers in jeopardy? The answer, it seems, is not as simple as a yes or a no, but one thing is certain. With health workers at the front line, the mask debate is far from a simple conversation. How does this debate affect the people battling this pandemic at the front line? Let's delve into the experiences of those who are at the heart of this issue, our health workers. The mask debate isn't just a topic of conversation for these individuals. It's a life or death reality that they confront daily. They are not just observers of this debate, but active participants fighting for their safety and the well-being of their patients. Health workers like doctors, nurses, and paramedics have shared that the ongoing mask debate has added another layer of stress to their already demanding roles. They're not just battling the virus, but also the misinformation and misconceptions surrounding it. The lack of consensus on mask wearing has led to an increase in COVID-19 cases, putting even more pressure on our health systems and the workers who keep them running. Imagine working long, grueling hours, only to come home and see the very measures you're advocating for being debated, dismissed, or even ridiculed. It's not just physically exhausting, but emotionally draining as well. In addition to the increased workload, health workers are also at a greater risk of contracting the virus. They're on the front line, exposed to the virus daily, and the lack of mask wearing increases their risk substantially. They're not just worried about their own health, but also the health of their loved ones. After all, they could inadvertently bring the virus home with them. This isn't just a job for them. It's a commitment to the well-being of our communities. They're the ones who hold our hands when we're sick, who comfort us when we're scared, who fight for us when we're weak. They deserve our respect, our gratitude, and our cooperation. So, when we discuss the mask debate, let's not forget the voices of those who are most affected by it. Let's listen to our health workers, the people who are fighting this virus at the front line. Because, in the words of these brave individuals, it's clear that the mask debate has real-world consequences. What does the science say about the efficacy of masks? We've all asked this question at some point, so let's delve into the scientific evidence supporting the use of masks in preventing the spread of COVID-19. First off, masks primarily act as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people. This is particularly crucial since the virus that causes COVID-19 spreads mainly among people who are in close contact with one another, typically through respiratory droplets from coughs, sneezes, or even talking. Now, on to the studies. A comprehensive review of 50 studies published in The Lancet, a reputable medical journal, found that mask wearing reduced the risk of coronavirus infection by a whopping 65%. That's not just a small margin, but a significant one. And it's not just about protecting others. A study in Health Affairs compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia. It found that mask mandates led to a slowdown in daily COVID-19 growth rate, which became more apparent over time. The science also extends beyond COVID-19. Masks have been used effectively in various settings to prevent the spread of other respiratory diseases. For instance, during the SARS epidemic in 2003, mask usage was widespread in Hong Kong, and this was associated with significantly reduced risks of acquiring the virus. To give a more visual representation, think of masks as the shields in a battle. They may not be perfect, but they significantly reduce the chances of being hit. And it's not just about choosing to wear a mask, but also wearing it correctly. A mask should cover both the nose and mouth to keep respiratory droplets contained. A mask worn improperly, such as under the nose or under the chin, greatly reduces its effectiveness. It's clear that scientifically, masks play a crucial role in controlling the pandemic. Where does public opinion stand, and how much of it is influenced by misinformation? A question that takes us into the labyrinth of perspectives, beliefs, and misconceptions. As we navigate this maze, we find that public opinion on mask usage is as diverse as the people themselves. It shifts and sways across different regions, reflecting a kaleidoscope of influences, from cultural norms to political leanings. In some parts of the world, wearing masks has become as common as wearing shoes, a necessary part of stepping out into the public sphere. In other regions, however, masks are seen as an infringement on personal liberties, a symbol of control rather than protection. Now let's delve into the murkier waters of misinformation. Misinformation, as we know, is not just inaccurate information. It is information that is deliberately intended to mislead. And when it comes to the topic of masks, misinformation is rife. Studies show that misinformation about mask usage can spread as rapidly as the virus itself. It slithers through social media platforms, whispers in group chats, and subtly alters perceptions. False claims range from the absurd that masks can cause carbon dioxide poisoning to the deceptive that only the sick need to wear masks. These inaccuracies not only shape public opinion, but can also have a profound impact on behavior. A survey conducted in 2023 revealed that those who believed in mask-related misinformation were less likely to wear masks, thereby increasing their risk of infection and transmission. So, where does this leave us? With a public divided and a virus undeterred, it's clear that misinformation is not just a matter of differing opinions. It's a matter of public health, of community safety, and ultimately, of lives saved or lost. Misinformation plays a significant role in shaping public opinion, with potentially dangerous consequences. This is a battle we must all fight, not just on the front lines, but in the everyday choices we make and the information we choose to share. With health workers in jeopardy again, what can we do to support them? This question brings us to the conclusion of our discussion. We've explored the mask debate, heard the perspective of health workers, delved into the science of masks, and confronted the role of public opinion and misinformation. Now, it's time to consider our path forward. Supporting our health workers is not just a matter of gratitude, it's a matter of public health and safety. One of the most effective ways to do this is by adhering to mask guidelines. Masks are proven to be a simple and effective way to prevent the spread of the virus. By wearing a mask, we're not just protecting ourselves but also those around us, including our health workers. The next step is vaccination. Vaccines have shown remarkable efficacy in reducing the severity of the virus and slowing its spread. By getting vaccinated, we're contributing to the larger goal of reaching herd immunity, which would significantly ease the burden on our healthcare system and protect our health workers. However, these steps alone are not enough. We must also combat misinformation. In this digital age, misinformation can spread quickly and widely, causing confusion and resistance. Therefore, it's crucial to rely on credible sources for information and to share that accurate information with others. Above all, we must remember that controlling the pandemic is a collective responsibility. Each one of us has a role to play. Whether it's wearing a mask, getting vaccinated, or spreading accurate information, our actions can make a significant difference. The pandemic has put immense strain on our health workers. It's now up to us to ease that strain. As we move forward, let's remember that our health workers are not just on the front lines of this battle. They are the heart of our healthcare system, and they deserve our utmost support and respect. In these trying times, it's more important than ever to stand together and support our health workers.